Good day, everybody. Welcome to another reading by the El Kebilan Times. Today we'll be reading Saffron is an expensive herb, preventing macular lesions. Saffron is an expensive herb, preventing macular lesions and protecting eyesight after the age of 50. Many people will be troubled by age-related macular degeneration, AMD. Western medicine now has no good treatment. However, in recent years, studies have found that an expensive cooking spice, also a herb with a long history, is very helpful to this eye disease, namely saffron. According to the American Macular Degeneration Foundation, more than 1 in 10 million Americans will suffer from this disease. The macula is a small point near the center of the retina, which is responsible for sensing the object directly in front. When the macula is damaged, people can't see the object in the center of the field of vision. With the deterioration of the disease, the image in the central area of the visual field will become more and more blurred, and the contrast and color quality of the image will decline. This causes a lot of inconvenience to the patient's life, such as being unable to recognize the human face, difficulties in reading, driving, working, cooking, watching TV, and other daily affairs. In addition to age, smoking, sun exposure, hypertension, and obesity are all risk factors for the disease. Exercise, eating more vegetables and fish will reduce the risk of the disease. In recent years, some studies have found that some specific nutrients are particularly effective in the prevention and treatment of macular lesions. The National Eye Institute completed 2 studies on macular lesions, AREDS and AREDS2. AREDS research shows that vitamin C, vitamin E, carotene, zinc and copper will reduce the risk of macular disease deterioration to advanced stages by 25%. AREDS2 study found that the combination of lutein and zeaxanthin together with vitamin C, vitamin E, zinc, and copper will further reduce the risk of advanced macular disease. After the age of 50, many people will be troubled by age-related macular degeneration, AMD. Western medicine now has no good treatment. Other studies have shown that rosemary can prevent macular lesions. Another study by Australian and Italian researchers shows that saffron, a spice commonly used in the Mediterranean diet, can help slow down the deterioration of macular lesions and improve vision. In a 2010 study, 25 patients with early macular lesions were randomly divided into 2 groups. One group took placebos and the other group took 20 milligrams of saffron supplement every day. After 90 days, the vision of the 2 groups were compared. This is a double-blind experiment. That is, participants and researchers do not know who takes saffron and who takes the placebo until the end of the experiment. This is a more rigorous experimental method to avoid the impact of the psychological effects of the personnel of all parties in the experiment. The results showed that the vision of the participants in the saffron group was significantly better than that of the other group. Another study conducted the experiment for a longer time in 2012. 29 patients with early macular lesions aged between 55 and 85 took 20 milligrams saffron supplement every day for 14 months. The experimental results show that the visual acuity of these participants was significantly improved. Moreover, Participants said that the utility of vision, including the contrast and color quality of visual images, had also been restored, and their reading and night vision abilities had also been improved. These changes have significantly improved the quality of life of patients. Why can saffron protect eyesight? It is found that crocin and quercetin in saffron are the active chemical components. These are two antioxidant derivatives of carotene. Saffron protects photoreceptors from light death. Saffron acid can improve the oxygen absorption capacity of cells. Scientific research has confirmed that saffron also contains more than 150 healthy volatile and aromatic compounds. 8. Saffron can help treat Alzheimer's disease. A study published in the journal Psychopharmacology in 2010 showed that saffron was better than Aricept in treating Alzheimer's disease. This is also a double-blind experiment. The participants were patients with mild to moderate Alzheimer's disease. They took saffron 15 milligrams twice a day for 22 weeks. Another 16-week similar comparative experiment also saw the same results. Saffron is safe and effective in the treatment of mild to moderate Alzheimer's disease. The efficacy of saffron in the treatment of depression is comparable to Prozac. A double-blind experiment study published in the journal Progress in Neuropsychopharmacology and Biological Psychiatry shows that the efficacy of 15 milligrams saffron twice a day in the treatment of depression is similar to that of Prozac. The remission rate is 25%, which also helps to improve the side effects of sexual dysfunction caused by Prozac. A study published in 2004 confirmed that saffron is equivalent to imipramine in the treatment of mild to moderate depression. A comparative study published in the Journal of Integrated Medicine in 2013 shows that saffron is very effective in the treatment of mild depression. The effects of saffron found in other studies also include increasing satiety, helping to lose weight. The effect of relieving menstrual pain is better than that of non-steroidal anti-inflammatory drugs, also known as NSAID. Relieve premenstrual tension syndrome. Cancer prevention. Other studies have shown that Crocus sativus can protect blood vessels, relieve symptoms of diabetes, and improve cognitive decline associated with aging. How to eat saffron. Saffron is a dark red or yellow stamen in air-dried crocus. Because it is more expensive, many people don't use it to cook. Saffron is probably the most expensive cooking spice, up to $1,500 per pound. Think about it. It takes about 15,000 crocuses to collect 3.5 ounces of dried saffron filaments. Each flower blooms for only 1 week a year. All these stamens need to be picked by hand, but in fact, you don't need to use a lot when cooking. Just a handful of about 20 sticks is enough. This is it for today, guys. Please remember to like and subscribe and click the notification bell button and leave your comment about what you think about this reading. Good day.